real quick. And I know some people kind of join us throughout the session as well too. So, and that's a-okay. I'm just going to keep watching for people to pop in. But everyone, welcome, welcome to our Learning Bites. We do this every Tuesday and every Thursday at 3:30 Pacific time. I know that's not the most favorable time for everyone, but hopefully it works. I am so excited today because I have a guest with me, Kim Haynes, and she is going to walk us through the power of UDI. And I just am so excited that you're here, Kim. So thank you for blessing us with your presence and your knowledge and your education. So I'm going to let you kind of take it away.
Wonderful. Thank you so much, Angelique. I feel privileged that you invited me to the call. Um, I know the work that you're doing and the passion you bring to solving some of these supply chain and healthcare opportunities. I'm so excited to talk to you about the power of UDI. I know you gave an intro. I've got several decades of healthcare experience. And my goal is really to kind of shed light on where we can continue to build our knowledge and understand where UDI can really provide a lot of value to your organization and help you in some of those areas that are really difficult to manage. With my first slide, you'll see that I kicked it off with a Star Wars theme. And really, when I think about it, probably dates me a little, but Star Wars was a big thing when I was a kid. And it felt so far away, right? It felt like that is a world we would never understand in our lifetime. And as we're seeing in healthcare and in data and systems and internet and everything that's come decade upon decade, we see this continuous fast-paced movement into how we're taking healthcare out of the dark ages and into a future forward path. So um, my reference to Star Wars is really how do we embrace the power that UDI can really help us do our day-to-day jobs? And thinking about, especially back in when I was, working on the provider side, how do you work smarter, not harder, right? So how do you use information as a tool so that you can focus on more of those strategic things that you really need to get your arms wrapped around to really progress and move your departments or your health systems along. And so let's look at all of the things that are out there. One of the things I will say is I feel like there's a lot of deer in the headlight right now with all the different technologies that are out there. And it can feel very overwhelming and very scary. But you got to just break them down into what needs do I have? What does my current health system look like? And then how do I bridge those things together to see where we could patch some of those holes? Because not every health system can afford all the latest and greatest technology, but there's enough out there that can really help you in some of the areas that you're struggling with today.
Yeah. Hey, Kim, real quick, because I know that we have some also newbies to healthcare supply chain on the call. Can you explain what UDI is?
I love that question. Actually, I was going to throw it out in the chat.
Oh,
Can everybody find their little chat uh, box and type in if you know what UDI stands for? I know it sounds like a Star Wars character name, but it actually stands for uh, something, and it's not UDI. Identification system. Thank you, Maribel. What does the U stand for?
Mm,
Crystal, Abigail, I don't know if you're driving, but if you can throw unique,
unique.
wonderful,
Oh, boom.
nailed it. Gold star for you. Yeah, so it's your unique device identifier. It really has been developed as a way that supplies, like they do in almost every other industry, can have a common language, healthcare never had a common language. So it's a way to say, how do I know what I'm using is the same item that is at a different hospital or a different department? And how do we use that common language to all communicate?
Love it.
All
Good,
right.
good.
So we're going to dive into it. Part of the objectives that we're going to cover for today, we're going to really look at what it is at a deeper level, right? Let's break it down and understand what it means. Where do we find it? You know, where does it live on these supplies? We want to talk about why it matters. This is where we're going to start having the light bulb moments to say, oh, this could really help me here, or this could really help me with these type of scenarios. So we really want to start connecting some of those whys of how UDI can play a critical role in solving complex problems. How do we find it in terms of the systems, meaning where can I access it from an internet perspective, or where do I find these unique device identifier numbers? So we'll talk a little bit about that, and then that will start us going down the path of then where you can implement it, right? Where are places within your healthcare environment that we can apply it and really help streamline maybe some workflows, streamline some black holes, as we're talking Star Wars, or blind spots, and then what those use cases look like. Okay, I'll walk you through just a couple. There's a whole lot more, but just due to time, I just wanted to keep it simple and talk about a couple that will get your mind thinking of where you can apply it.
Awesome.
All right, so we're going to dive into what is UDI. Using your chat, anybody want to take a guess at who initiated the FDA mandate, what year they completed all of that information, and they were getting ready to kick it off?
Mm.
Take a guess.
Hmm.
It's in the 20s. You got
Oh,
25 choices.
wow. Almost 100 years ago is what you're saying then.
No, within 25 years.
Oh, within this last 25 years. Oh. Wow.
2000.
Okay. Hmm.
A little on the low side, Crystal. Any other second guesses? Crystal guessed 2000, 2010. Maribel, you're close. It's 2013. Um,
2013.
2013. I
I thought
remember
this was
when,
older than that.
well,
Kim.
the work, you have to think about this. There was a ton, probably a decade or so more of work that went into the FDA just getting their arms wrapped around this.
Hmm.
But when they finally put a bow on it and put it into a package and said, okay, vendors, we need you to participate now, the mandate started in 2013. However, we're in 2025. We move at a snail's pace in healthcare, right? Because
Yeah.
we still have some compliance issues that exist within this UDI mandate that went on from the FDA. And we'll kind of talk about some of those challenges that exist. But the goal was really to push it out, roll it out into phases. So they obviously wanted to start with the most critical devices. And they wanted to make sure that by the end of 2014, they were really getting all of those class threes, anything that's implantable, anything that can cause harm. They wanted to make sure that all of the vendors in the industry were going on to the FDA website and registering those products and making sure everything had an associated unique device identifier. Say
Okay.
that 10 times.
Love it.
Um, yeah, so with that, then they rolled out class two and then class one. Okay. Um, class two and one got really slow, really slow. I'd say class three, we had I'd say really good participation. Most vendors were doing what they were supposed to do in the best timely manner. especially a lot of the bigger companies. They knew if they had to do business with health systems, they had to be compliant. So the class threes weren't as problematic as the class 2 and 1s have been. Okay. So the whole purpose of the UDI is going back to that universal language, right? How can we all communicate? How do we have one source of truth? What supplies we're buying and dealing with? But the UDI also created some unique challenges in the market that we'll get into. So where do you find it? This is one, took a bunch of pictures just to show you a bunch of different ways that you may see it on products. There are scenarios where the barcode that tells you what that unique identifier is might be all in one full strip of information. You're also going to see packaging where you get confused, where you're like, oh my God, is it this barcode? Is it this barcode? Or is it this barcode? Where there's more than one barcode that then you aren't sure which one is the correct one. Okay. My favorite one, not to pick favorites, but is the QR barcode. Those ones are the best. However, they can also trick you because some of them are not QR barcodes. They are product information barcodes. So you can understand where UDI has been a great, way to build out a more common language, making sure that all health systems are educated on knowing where to find them has been a bigger mission and a bigger challenge of making sure everybody understands what they are and where to find them. You also have scenarios where you've got what we call double stackers or even triple stackers. They take all of the information and they put them on 3 lines or 2 lines. And so when you're scanning these UDIs, you have to make sure you grab both pieces of information to get the full amount of information that you're looking for.
So, Kim, question for you. My assumption is that you're going to need to program your ERP system, whether you're on Workday or Infor Lawson or Oracle PeopleSoft, to be able to read that and accept it into your ERP system. So, if it's coming in multiple variations, you're going to need to make sure that your ERP system will accept it in not only one form. Right?
Great call out. So it's I'm going to walk through kind of the anatomy of what the UDI is in a minute. So that'll kind of connect a little bit more of what I'm going to tell you. It's more about the scanner. Can the scanner do all of these different variations of scanning? Right?
Okay, got it. Yeah.
Because the ERP system is going to have the G10 alignment that should connect to to part of that UDI. Okay.
Love it. Okay.
One of the things I do want to call out with the UDI, they also have, because it's unique, they wanted everything to have its own unique identifier. It has a different number associated to it if it's an each, a box, or a case. Okay. So what often people make the mistake in their ERP system is they only flood it with one unit of measure, G10. But when you think about how supplies are used in healthcare, most of them are used at the each level, right? Mm-hmm. You might move products in your warehouse at the case level, but most of your supplies are going to live on your shelf in the box or the each. So when they're trying to connect their ERP to their point of use system, no nurse is going to scan a case. They're going to scan an each, and it's going to show a mismatch.
Yeah, that makes sense.
So you have to think about, to your point, the type of scanning that can capture it, and then making sure you've got all the unit of measures built out within your system.
Yeah. Okay.
Okay. All right. So let's break the anatomy down. This is what will help educate people who are looking at the various different types of packaging and why you have to pay attention. I always say pay attention to the brackets. When you see a barcode that has a bracket in it, that typically is going to show you that that's got a piece of information that's part of that UDI. So if you see on the screen, you've got a bracket around 01. If you look up here, 01 is your G10. Okay, so that's your manufacturer information, that's your reference part numbers, that's all your basic vendor information that you want to know about that particular product that's on your shelf. If you keep following that number all the way across, you come to another bracket. That next bracket is the 11. The 11 can tell you manufacture date, which I don't have it up here. And that might be critical or not critical, but some UDIs it's baked into. Then you come to your 17. So 17, if I look up here, that's my expiration date. Okay. We want to know expiration date because if we're trying to proactively manage expirations, this is the place to go. Now, when you look at a package, so many people get confused between manufacturer and expiration dates because the symbols can be confusing on the way they read. The bracket 10 means lot number, so very important for recalls. So that's going to tell us if you've got a recall, it can tell us specifically what products that they're going to specifically fall under. And then the last bracket is going to be your serial number. So those things that are implantable that need to be tracked beyond just a single use, and it's going to have the serial number embedded into that barcode. Again, remember, this is one straight line of a barcode that's a UDI. This could be 4 different lines on one packaging, could be 2 lines on another packaging, could be in a QR code on another packaging. Okay, so that's where we got to educate people is pay attention to those things that are going to alert you to what you're trying to access out of what you're scanning.
Okay.
All right. So with the FDA creating this, universal language, they had created a national website called Access Good ID, Good UDI. And so the way it works is that vendors have to register all of their information in here. And then this website is available for anybody to go in and look up any information, and it's going to allow you to drill down to anything you want to know about it. If we ever have time at the end, I'm certainly happy to jump in with you. You can look up things different ways through character searches, through a catalog number, a reference number, and there's different ways you can search to try and find information, and then you can drill down into what that UDI is at the each, and at the case, and at the box. Okay. One of the challenges I will tell you is with vendor compliance is sometimes they'll fill in the case, but they forget to put in the each, or they forget to put in the box. And so that's been the challenge in the market when people are adopting new ERP systems. They're trying to update their information. They have all these gaps of information or blank spots that they can't fill in because they don't know how or where to find all that information.
Hey,
Right.
Kim, does that system connect to like recalls as well?
It doesn't connect exactly together, but it's that same database. It's that same FDA database.
Okay, got it. Because we just did a big recalls learning bites. Was it 2 weeks ago, I think? So it kind of ties to that as well.
Well, what is really great about the UDI, one of the challenges when it comes to recalls is that we know, probably outside of procedural areas, except for ER, when you talk about ER, OR, GI, cath lab, IR, anywhere that's doing a procedure or kind of that fast moving environment, you've got supplies that live everywhere. They don't just live in 5 West nursing, you know, unit storage closet. So when the recall hits, it's easier to find those items in those, med surge nursing unit locations. It's much harder to find them in the procedural spaces because they live in specialty carts, they live in OR suites, they live in all these different locations that make it harder to dig out those items from a recall perspective. So, how do you start using it? So, one of the ways that a lot of people are I'd say, overlook using UDI is if you've got existing UDI scanning capabilities in your healthcare system today, this can be a great way to collect information. So, if you do need to know what your UDI, maybe you're missing a bunch of G10s and you need to plug it in to fill those gaps in your ERP system, you could scan it at the box, the case, if you need to fill in some of those blanks. Now, if your blanks are really big, you might need a service to kind of help kind of fill in kind of the faster, ways of getting some of that data cleaned up. But as you're onboarding new product, and it's going through your value analysis processes and it's getting set up and you notice you're missing some G10 information, that might be a good opportunity. You can go into the Access Good ID database, look and see if you can find it there or scan it to try and pull those pieces of information together. One of the things we often find is that, especially in procedural spaces, supplies live in stock or non-stock scenarios. So we've got those situations where those items may not have a bin location. Those items may not have a par location. And so I call those the headache areas that we all have to deal with. And trust me, I was a nurse. I was a culprit to the problem before I knew that I was caught part of the problem that was really hurting me more than was hurting supply chain. If I'm a nurse, I'm going into a room and I open an item in my specialty cart and I notice it's expired. What do? I run out of the room and I go and grab stock somewhere else. What does that do to supply chain? Throws off your reorder patterns. It throws off you may have just stocked it and now you're stocked out. So it creates a perpetual problem when you have these out of sight areas that nobody's managing, right? So it's a great way to understand what lives in those out of sight, regardless of who manages it, and then how to close that gap of information to protect your own inventory if you're responsible for just the stock items. We'll talk a little bit about consignment implants and then expiration recall. Obviously, we know that UDI gives us that information that can really help us be more proactive than reactive when it comes to recall, knowing where things live on the shelf, and then expiration, about being aware of what you need to move through your system faster if it's in an area that moves slow. All right, use cases. I know we're down to a few minutes, so I'm going to quickly run through these and talk a little fast. First area is really our vendor implants. So this is an area sometimes where not all hospitals can afford an RFID technology, and you also need the manpower to put those tags on every single item that comes in the door. So there's different costs associated to labor and technology investment. So using UDI can at least help you understand what is living on your shelf and having a better reconciliation process when things are scanned into a procedure or documented to know either what you have to bill and replace, or if you're doing any type of consignment, reconciliation with vendors, You can scan things that are living on your shelf. And then when they send you that bill and replace uh, invoice, then you know how to reconcile both of those scenarios. So we know this isn't a challenge in a lot of hospitals of, where do you invest in dollars to really manage these high dollar areas and put some better controls in knowing what's on the shelf and when it's used and when you got to replace it. Jump right into high value. Again, sometimes that threshold of where that RFID may not meet the criteria. Some people do it by dollar value. Some people do it by certain vendors or certain departments. Again, it doesn't mean you don't want to have some controls and oversight over these extremely high value supplies that can cost your organization a ton of money if they go out of sight or if they go expired and no one's really paying attention. Those are dollars wasted, right? So we know that this might be a way that you can use your UDI in a workflow that can help you look and see proactively of what's on the shelf and where you can make some good data-driven decisions on how to manage that.
Hey, Kim, real quick, if I'm doing a physical inventory in one of those procedural areas, my annual physical, let's just say, can I use that system then to kind of help me have efficiencies through that workflow or at least do it faster? Because that is
Oh,
very, very tedious, right?
love that question. My opinion is physical inventory historically has been an evaluation process, right? It's just so finance can get the dollars and say, yep, you're within your variance. Great, check a box.
Yeah.
Use it to dig deeper. If you're going to spend the time to see what's sitting on your shelf, you might as well scan it because that data, to your point, is going to help you understand what's ahead. What's that tidal wave look like ahead? What's going to expire in the next 30, 60, 90 days? How much true inventory am I really sitting on? Because a lot of times, the finance process is trying to make that variance low, but the pressures of the OR are saying, why are my inventory dollars so high? Right? Is it that people are ordering stock and non-stock interchangeably and it's getting piled up on a shelf because nobody knows about it?
Yeah.
These are the things we can uncover to understand what the true state of the union looks like, and then help you use the data so that you can make those decisions on how do I reduce my inventory levels? How do I get my par levels down? How do I consolidate locations? Because I keep having the same 5 items expire over and over in this location because nobody's turning it.
True, true. Okay.
Okay. Last one, crash carts, always a monster. Low value supplies, but a ton of labor that goes into making sure you know what's going to expire, and especially for recalls. So with that, I can jump into the massive action checklist. Feel like you need some music for that part, Angelique.
Yeah. Da-na-na-na.
And if I'm out of time, I know everybody can read, so I
No,
don't
no,
have
you're
to
good.
go through it.
No, go through it real quick
Go
because
through it.
they're going to get the massive action checklist in their email. And
Okay.
I know that there's lots of people who can't always join us live, but they love to listen to it on the way home or whatever. So they love to get the massive action checklist. So if you could just go through like the simple basics here
Yep.
of these 6, but just so you know, there's so much more to this that Kim put together within there's detailed steps for each one, but we want you guys to be able to find value in doing this tomorrow or next week, that you're going to find value out of the training that she did today.
Yeah, I would say number one, like survey what technologies you have in place today. Because healthcare is constantly looking at buying new or adding on, and sometimes they're not looking at what's existing, right?
Yeah.
What do you already have that you could be using, or what do you know about UDI in how you're using it within your health system today, and can you expand it, or could you bring it in if nobody's using it in your healthcare today? So figure out what technologies are in play and how UDI is currently being used to make good decisions within your organization. Find out what your policy is around how you're currently managing expiration and recall. I find I walk into hospitals across the country, hundreds of them, and most people really don't know. Or they're like, I think so and so tracks that. Or we don't track that, but we know we are probably throwing out a lot of money. Um, it, it's it's one of those things like blood pressure. It can all of a sudden creep up and cause a heart attack without even knowing you had high blood pressure. Expiration management is the exact same thing. It can all of a sudden explain why your year over year budget is exploding and you can't figure out what's going on because people are throwing it away and not telling you. There's no reconciliation process. Okay.
Okay.
So find out your policy. And then if they do at least have a baseline, what are you doing to mitigate it, right? Is there a plan? Is there a process to bring that number down? What is the goal? Do you want to be at a certain percentage, across the board? What's acceptable? Because net zero is probably likely hard. But year over year, you can get much closer to that over time, or year over year, you can get better about making decisions to give it to missions so they can actually use it before it expires. So there's different ways to think about how it can play out, just having data. ERP systems, we talked about that at great length. Are you currently either cleaning up your existing MMIS? Are you moving to an ERP? Where's your gaps? Where's your holes? How are you going to fill them? Find out if nurses are using point of use at point of care, and are they scanning barcodes? If so, find out, how do they know what UDI is? Do they know to look for that? Because maybe, they are, some of them could be scanning the wrong thing and then they can't find it and then it gets a mischarge, right?
Mm.
So it's different ways that it has an impact around making sure you understand consumption. And then to me, just find out one benefit of where you see UDI could really help you today. Even if it's small, like, oh, this is something I constantly struggle with. There could be some simple solutions out there. You may even have tools at your fingertips you could be using. But UDI has a lot of power. It's got a lot of information. It's just a matter about pulling it out, how to use it, and then how to look at that data to make good, proactive decisions.
It sounds like you're going to have to come back and do another learning bite with us on how to dissect all the data and then have a massive action checklist of what then we do with all of the data.
Love it. I would love to
Okay.
come.
Okay.
So that's a great next step.
Love it. Love it.
Awesome. So I don't know if anybody has any questions, or I'll let you wrap it up then, Angelique, in terms of next steps. I am going to send you some tools that Angelique talked about, with the massive action checklist that needs music in the background, and then a sample template, business use case of how do I sell this to my organization? How do I show them what the benefits are? What is the ROI potentially looking like? So we put together a generic one with some UDI language in it. Obviously, modify it to fit your story and your narrative, but it at least gives you some framework of how you could maybe approach it with your leadership.
That's amazing because, hey, all of us know in healthcare supply chain that the hardest part is influencing our senior leaderships to spend any money on a tool or the reason why we need something. Unless a consultant comes in and tells them, they don't listen to us as professionals
You
that
could
are
beat
really
your head
telling
against
them.
the wall and have blood coming down, and they're like, Oh, that's a novel idea when somebody else says it.
Yeah, I've been saying it for 5 years, but a consultant says it once and you pay him a 200 grand to say it.
Frustrating.
My gosh, the
Understand.
pressure. Is that your last slide,
That's
Kim?
it. That's all. I just questions. If anybody's got some questions.
Anyone have any questions? Okay, this was super duper amazing, Kim.
Yeah.
As Kim's stated, I'm going to send you guys the massive action checklist, the PowerPoint so that you have it, her amazing business case template, and then you guys will have the recording so you can listen to it again if as you're walking through this process over the next couple weeks. And I really just want to make sure that as a team, if you guys ever have any questions and you're like, hey, I watched this learning bite like 3 weeks ago, Angelique, and I'm really, really confused about something. Please reach out to me. And if it's from a guest, I can always reach out to the guest and say, hey, Kim, I got a question that came in, 3 weeks later after the learning bite, and we can get answers for you because Kim's always here. So that's amazing. Maribel, were you going to ask a question?
Yes, that I really enjoyed this. This is actually good information.
And thank you for participating.
Yeah, sorry. I don't know what's going on with my email. I went and I had IT take a look at it and they're like, oh, no, it's the same thing. So
You're good. You're good. You're good. No problem. And so just remember, everybody, it's every Tuesday and Thursday, same time. And either usually I'm training it or a guest as amazing as Kim is training it, and all different topics, healthcare supply chain, because we want you guys to just keep learning and learning.
Oh, perfect.
Sound
Thank you.
good?
Yes.
All right. Thank you,
having
Kim. We appreciate you.
Thank
Bye.
Thank
you.
you, guys.
May the source of truth be with you.
That's right. All right. Bye,
Perfect.
everyone. Take
Bye.
care.
Bye.